So question 3. The governor has proposed shifting future retiree health care costs from state and municipal employers to individual retirees. Retiree health care benefits help attract quality public service employees with valuable skills and expertise. Retiree health insurance is part of the package of compensation and benefits that has been promised to thousands of employees for many years. The question is, will you oppose any attempts to reduce the state's contribution to retiree health care for current public employees?
Yes, absolutely. You're 100% correct, Joe. We need to attract the top talent, and we need to make sure that they're provided for now and in the future.
Thank you, Craig.
Thank you, Joe.
Christine?
Yes, so I'm a healthcare advocate, and I've spent most of my career working with patients, and this is actually something that's happening in a lot of sectors, that the way that we're dealing with health costs is by shifting costs onto the families and onto the patient, and that's the wrong way to deal with healthcare costs. As state rep, I want to deal with costs. It's something critical that we need to look at in our Commonwealth, but shifting the costs onto the workers and onto their families is not the way to deal with it. And I'm ready to work on that.
Thank you, Christine. Erin?
So this is a long trend. In the last, I believe, 2 decades, retirees of union workers, especially in urban cities in this Commonwealth, they have been chipping away at their benefits. Part of the reason we get dedicated people to work in these jobs is because they know that they're going to work hard for less money throughout their career, but they're going to have their health insurance and their benefits, and they're going to have that security into their retirement. If we start taking that away, we're going to have the people thinking twice before they take these roles in these positions that we do so desperately count on. These are the men and women that show up at your house when someone's sick, or your house is on fire, or someone has robbed you or hurt you. These are the men and women that are teaching our children, that spend more hours with them on a daily basis than we do as parents.
Thank you, Erin. Nick?
I think we're talking about one of the past bills that was brought forward was Health Bill H59. I believe what that bill was meant to do was to address the $46 billion in unfunded liability. Unfortunately, that bill it was flawed and it attacked most people that were out there that are retired now that can barely keep their head afloat, but they were the ones that are out there protecting our street corners. They're the ones that developed this community. So the last thing we want to be doing is hurting these people. Unfortunately, though, we do have a problem, and that is the $46 billion in unfunded liability that we do have to address at some point. I think it's the wrong approach to be attacking those current people that are currently working and the people that are retired, because it's hard. It's hard to make it 7 days a week. People are barely being able to get food on the table. So if I'm your state representative, I'm going to do everything in my power to ensure that you guys are protected. But at the same time, we're going to have to sit down at some point, because we do have an issue. We do have a problem. If it's not addressed, we're going to, it could collapse.
I'm going to allow Erin DiBenedetto on a rebuttal.
We cannot pay back our debt or lower it down on the backs of the people that work hard for our community. That is not how we should move forward in this. We need to move forward in a different light. It should not be on the backs of the men and women who serve our communities. That would be out of the question to me as a state representative, and I wouldn't even consider that.
Thank you, Erin. Nick, you want to use some time?
Yes. Well,
okay.
Yeah, no, I agree with Erin. And then I look at the way this legislature is wasting its money. For example, $20 million, I'm sorry, on a new room, a new house room, $9 million on the governor's office. There's so much waste that right now currently in the office, and it's disgusting because there are so many people that are struggling. We should be directing that waste and fueling it towards people that need it. So if I'm elected, I'm going to be sure to help turn that towards those that need it most.
Thank you, Nick.